Remember this? This is the KN95 mask, the type we use to offer protection from the deadly coronavirus. 3 years later, how you can benefit from lessons that we learned the hard way. The virus that does not discriminate exposed for all to see the health disparities that played a role in who contracted, who was sickened, or who was killed by the coronavirus.
COVID brought light or brought some things from under the cover to the light relative to people with disabilities, for instance, and their lack of access to care. Many times they would stand in line and then even maybe get turned away because maybe they were deaf or maybe English wasn't a first language.
At community-based vaccination clinics across the region, Melody Armstrong from the NSU Department of Nursing and Allied Health saw firsthand the effects of health disparities.
Everything from high blood pressure to diabetes to sickle cell, different chronic illnesses.
Next week, in what Armstrong says is a first of its kind, health professionals from NSU, ODU, EVMS, and the Centers for Disease Control will use data to build a bridge to good health. This will help the community be better prepared for the next pandemic.
Yes, it's a way to say, let's look at these lessons, and then what can we come together and brainstorm, coming up with recommendations, strategies that we know that are evidence-based, that have worked.
Now, the post-pandemic conference, October 25 and 26 at the downtown Norfolk Marriott, is free and open to the public. The parking is also free. To register for the event, see my story on wavy.com.